especially if it's due to a bacteria and we don't treat it, then they can actually get worse. And asthma is a problem of the airways that are blocking, they are narrowing, so air is not going in well. So the management usually is different. We use medicines to open the lungs, the airways where the air passes, and also to reduce inflammation. So however the two can coexist, the infections can trigger the asthma symptoms, which means we need to manage the two together. Yes.
All right, let me welcome our viewers at this point, of course, to engage with us on our socials at TV47 Kenya on Facebook and on YouTube, and on X at TV47 News KE. There will be a number on your screen shortly. You can call in live if you have a question for Daktari. Here we are talking about asthma and respiratory tract infection in children. And I'm sure you'll be happy to answer those questions.
I would be very happy to answer the questions.
So how common is asthma in children in Kenya as we speak? And have you seen noticeable increase in recent years? And, you know, a difference in how we are managing asthma in children? Has there been a difference?
Well, yeah, actually, there's actually a rise in the cases of asthma, probably because we are now aware of the symptoms and also because of urbanization and climate change. So it's usually more prevalent in urban areas compared to rural areas. However, the percentages range all the way from 3% to 28%. So there's a very high increase, especially in urban areas because of pollution. Many people have cars now, so there's exhaust fumes, there's dust and industrialization. So respiratory health has actually, the burden is increasing.
We've talked about asthma. You've told us what asthma is. So when we talk about respiratory tract infection, what is it and how different is it from asthma itself?
Oh, thank you so much. So I had actually mentioned it earlier on, but however, respiratory tract infections are usually infections.
Like pneumonia?
Like pneumonia, bronchiolitis. And these infections are caused by an organism. So it can be a bacteria or a virus. Those are usually the most common causes. So pneumonia a lot of time is caused by the bacteria. That's the most common cause. And the viruses also cause upper respiratory tract infections, acute nasopharyngitis, the common flu, the influenza, the RSV viruses, which are very common, and they cause infections. And asthma is predisposed, if there's genetics, high allergies in the family, children tend to get more allergies as well. There's coexistent nose allergies, eye allergies, itchy eyes, eczema, sensitive skin, and now the asthma. Yeah, and some food allergies, sorry.
All right. So can a child have both respiratory tract infection and asthma all at once? Yes,
yes. The triggers of childhood asthma symptoms majority are viral infections. So the child can actually have both. The infections triggering the asthma symptoms.
And do they interact in any way to worsen each other? Say this respiratory tract infection worsening to, you know, worsening this asthma situation, or asthma worsening the respiratory tract infection?
Indeed, it happens a lot. Children who we've diagnosed with asthma on management, and then they get a flu or a pneumonia, and the symptoms actually get worse because these airways are already blocking, and now there's something else going on in the lung, an infection, and worsening the symptoms. So we have to actually treat the infection and then continue to manage the asthma. So they can coexist. The infection actually clears within 7 days. Sometimes it takes longer. The coughs can linger on for 2 weeks or so, but it should clear. But the asthma symptoms, they come and go, they recur. So it's a chronic problem. So they come and go. So we use the medicines more often. Yeah.
So I started by saying you're going to tell us how it presents itself differently from children and adults. What are the symptoms, you know, that, you know, children don't have, that adults have, and that adults have, that children don't have?
All right. So